question is, what is a non-surgical breast lift? It involves PRP and more specifically fat. This is donor fat that we inject into your breast. We had a question, is it like filler? And so the principle is very similar to a hyaluronic acid filler, but we're using donor fat. I made the statement that the results were very similar to a breast implant. And by that I mean the aesthetic outcome. So 4 reasons that you would have a non-surgical breast lift. One of my favorite indications, and that's enhancement of the upper pole of the breast. And so as we get older, you can get that ski slope appearance. And what we can do with the fat is we can go in and inject it and really round off the upper portion of the breast. It looks really good when you're wearing your two-top, when you're wearing your low-cut dress, when you're wearing your bikini. It really fills out that area. Another indication is cleavage. This is another indication that I really like. We can really fill out that area, and that's even sometimes in people that have had implants, they have a wide gap, and they want that area to look more natural. Again, looks great in your bikini, your tube top. A third indication, if you've had implants and you have ripples or noticeable defects that you can see or feel, we can actually go in the subcutaneous tissue over the top and we can layer that and give you a cushion type effect and really camouflage some of those issues. Fourth indication that we would use this product would be asymmetry, and so one breast is larger than the other and we want to adjust one side, or areas of fat necrosis, or you've had tissue loss. So dimples, for example, would be a great indication for this. Question, can you get this in implants? And the answer is absolutely yes, you can. Certainly want to be very careful around the implants. We're not going into the implant cavity, but this would be where we would go in under the skin where the natural fat is, and we would layer that, give you a more natural look, again, and hide these potential deficits such as implant ripples. Most patients are satisfied with the results after just one treatment. There could be a few indications where we would come back, specifically if maybe you didn't get the volume that you desired. We certainly could come back and add more in. Typically, that's what I recommend. We start small, go from there so we can meet your expectations. So what is this not? It is not a substitute for a breast implant. And for that, I mean, if you are an A cup and you want to be a D cup, go see your local plastic surgeon. You're not going to be happy with this. So we're going to do a part 3 video, and we're going to continue to answer questions, so you guys keep them coming. Once again, guys, thanks again for tuning in. I'm Dr. Scott Williams at RegenXMD in North Mississippi. We're not far from Memphis to our north and Akron to the south. Come see us. And stay tuned to learn about the non-surgical butt augmentation.